So the purpose of today is we're going to talk about what a 504 is, what an IEP is. These terms are often discussed, and people don't know the difference between them, what qualifies a child for them. And I also wanted to point out that their education system is more than just 504s and IEPs, that there's other supports that the school can give. And a lot of the supports for each student is individualized. So what one student benefits from may not benefit a second student, even though they might have the same diagnoses. And there's a process to selecting which one will be the biggest benefit. Unfortunately, there's a lot of barriers to getting school resources. There are some ways you can advocate for your parents and try to empower your parents. And there's also some solutions that you can do in the office very quickly to try to help. So I really just want to kind of give a lay of the land of supports for students in schools. This is not just for education, it could be for social and emotional, and it could be for medical too. A lot of the 504 and IEP plans were were originally put into place for medical comorbidities as well. Vision impairments, hearing impairments, mobility impairments, other medical conditions that can impair learning. But what the schools have done is they've kind of created this pyramid, as you see here, um, where the bottom is for everybody. It's the things they provide for all students, regardless of disability and impairment, that can improve the educational value and the social emotional well-being of the students. So this can include after-school programs. This can include what some schools have, what they call lunch bunch. So kids that have trouble with either social anxiety or just meeting new students, or they feel a little bit left out, or someone who's on the higher functioning part of the autism spectrum. There's a teacher or an adult that just gets together with students and they either play games or find a topic. Some schools try to encourage people that have trouble with anxiety into certain recreational programs, such as theater or certain specialties within the technical high schools. So there's a lot of supports that the school and interventions that the school tries to do to try to help the mental health well-being. One of the more recent ones that are coming up is more and more schools are asking kids to put away cell phones to try to help with focus and to try to help with anxiety and their academics. But that is an intervention that's school-wide and applies to everyone. The next step here, we have the multi-tiered systems of support. And this is a little bit of the safety net or ways to try to identify kids that are falling behind either academically, socially, emotionally, or if they're noticing anything like they're having hearing or medical or hearing or visual impairments. So this is where the teachers, if they notice something, they can notify the special education office at their school, like, hey, John is falling behind on his tests. Maybe we should try to intervene with the child study team evaluation. So that is something that the school has put in for a warning system. Next up, after there's some impairments identified, this is for a select few students that were managed or found out through the MTSS, is that classrooms can have accommodations within the classroom. So this is trying to level out the playing field, so making sure that there's equal access for all students. And this falls under a different law than the IEP. This is actually under a civil right law. So this is trying to make adjustments within the classroom to level out the playing field and making sure that all kids can learn. Now, the IDEA Act is the IEP. This is interventions that happen out of the classroom. So this is only for a select few students who are not able to be served through accommodations as part of a 504 plan. And as you can see from the pyramid, the number of students that fall under each bucket should go down as the interventions become more intense. So with the Special Education Service as part of the IDEA Act, this ensures that all children, no matter what their disability, receives a free and appropriate public education. Now, this is probably one of the most important parts that I can share about this topic. All kids should be taken as is by the school district. Even if there's big behavioral concerns, a school cannot tell a child that they have to stay at home unless they are formally suspended, which is written down, or that they're saying that the kid needs an urgent psychiatric evaluation for safety. The school cannot say, hey, this child needs to stay home and you need to homeschool them. That's a violation of the free and appropriate public education. Um, so a lot of parents are unaware of that the school, no matter what the disability, no matter what is going on, no matter how hyperactive or trouble they're having with focus, that the schools have to adapt to adjust to the child's disability. And there are some qualifications to meet the IDEA Act. One of them is they must have a specified disability. That could be medical or education. Usually there's an evaluation, or there has to be an evaluation done to determine that eligibility. And there's, depending on the state, different categories, but there's 14 of Delaware that they make. Some of the ones that are more common is specific learning disorder. Another one is other health impairment, which falls under other, and that is ADHD. So ADHD is one of the more common disabilities, and that falls under other health impairment. So the IEP is a whole program that includes resources from outside the classroom to help address this child's unique educational need. Um, and part of this is the evaluation process. So as part of the evaluation process, they do psychological tests, they do educational tests, seeing where their reading level is, writing level is, their math level is. They do intelligence tests as part of the psychological evaluation. They do occupational therapy tests to determine how their handwriting and other manual tasks. They even do physical therapy evaluations if there's concerns about how they're moving about the classroom. Um, and some schools may even do psychiatric evaluations too. So there's a lot of testing, and I also left out speech and language evaluations, which also play a big role in this, where they're trying to determine why this child is falling behind. Now, a lot of schools don't do the best job of following through with parents about the results of that test because some of the results can lead you to a specific diagnosis. For example, if the Wechsler or the WISC 5 shows a full scale IQ of below 70 and their impairments in functioning, then that gives good evidence for an intellectual disability. If their IQ is within normal range, but their achievement tests, the WIATs, fall below fifth percentile, then that means they might have a specific learning disorder in reading and writing. And that could be the reason why they're having trouble in school, not necessarily ADHD. So when you hear one of your kids has an IEP, most of the time, or there should be some type of evaluation done. Parents have access and have a right to access that information. And please ask your families to bring in that packet, to bring in the evaluation test, and just keep it in your chart because there could be a lot of really helpful information that you could find there that normally would cost thousands of dollars if they got it in the outpatient setting, or insurance will really try to make you go through a lot of prior authorization steps if they want insurance to pay for it. But this is kind of like a psychological assessment that's done within the school. And as part of IEP, there has to be annual measurable goals. It could be number of sight words done, ability to communicate needs, ability to write a certain paragraph, being able to do these math calculations, being able to do this type of sight words. And they have to measure if the child's meeting those goals. Because when the child's not meeting those goals during the annual review, they have to put in more interventions. And I just put in the laws as part of this to show that this is written in law, that parents have rights, and we'll talk more about this later, but occasionally there were times where the education the family needed to hire an educational lawyer to help advocate for the child, or we'll talk more about resources later on, but there are parent advocacy groups that can help with this as well. Um, So other parts that fall under the IEP is accommodations for state tests and extended school year services. So if a child is in need of more support or re-emphasis of certain academic areas, then they can stay for what kids call summer school, but it's extended school year services. And the IEP, because it's stuff that involves people outside the classroom. Usually there's an occupational therapist, a speech therapist, occasionally a physical therapist, occasionally a psychologist for psychotherapy resources that can help provide resources to this family. This even includes reading aids and people that can help with learning how to write. So this is what families often call pullouts, where they have general education, but they get 2 hours of pull out per week for reading and writing. So Section 504 is a civil rights bill, and this is making sure that no matter what the physical or mental impairment, that they can be enrolled in school just like their peers. The barriers for this is a little bit lower because it's accommodations that are done within the classroom that the teacher can do. So they still must have an identified impairment. Again, it could be medical or educational, and these accommodations can help the child participate fully in school. So let's say the child is you feel like you have a parent, and the parent feels like his or her child is in need of resources, but for whatever reason, the school hasn't caught the school's MTSS system, that warning system that we talked about earlier, isn't picking up on the impairments, and the school hasn't really notified the parents, but the parents still feel like something's going up in school. Here's some warning signs for you to let the parent know that, hey, maybe your child, or maybe for Johnny or Jenny, that they could benefit from accommodations or an IEP plan. If you suspect that a child has an underlying learning disability or intellectual disability, then that could be a good reason to check with the parent to make sure they have a 504 or an IEP in school. Because if they have one of these two diagnoses, then they would really be in need of additional accommodations or supports from the school. If a parent comes in and they're saying, I think my child has ADHD because they're constantly failing, their grades dropped off. Yes, this is a pretty non-specific diagnosis. It could be anything from depression to anxiety to intellectual disability to PTSD to ADHD. But this is a good warning sign to check with the parents. Hey, did you speak with your child's school education office to talk about possible accommodations within the school? If a parent is talking about frequent phone calls, being sent home early, repeat school suspensions, that's also another reason to bring in a 504 IEP. If there's visual or auditory impairments, and if teachers are frequently contacting the school about Johnny not bringing in homework, Johnny not focusing on tests, you know, we know that your child's very intelligent, but they seem to make a lot of silly and careless mistakes, or they seem to be rushing, or they're not bringing in forms from the parents to be signed. That's also things that just doesn't fall on the parent. It also falls on the school too. And one of the ways that parents can let the school know is by requesting an evaluation um, from the special education office or the child study team. Also, if there's concern of poor social communication between um, your patient and his or her peers, this could not just be autism, but it could be for social anxiety and other conditions. If you're feeling like your patient is falling behind on speech or fine motor skills, this is also an area that can be addressed through school and school interventions. Um, this is becoming more and more common with the pandemic or the after effects of the pandemic, but school avoidance cannot just be no help from school and then um, the truancy court calling the family or notifying the family. The school can help and make accommodations for those with school avoidance and anxiety in going to school that results in missed or tardiness, with missed school days or being late to school. And also if there's continued conflict between your patient and his or her peers. So this is part of the testing components that come with a 504 or an IEP. Now, this doesn't have to be all of these scales for every child. It's really depending on the impairment. For example, if there's really concern about academics or the intellectual functioning, you can make sure to have a psychological evaluation if they're having trouble with communicating. You can make sure to have a speech and language evaluation. If there's a lot of concern for ADHD, there's a lot of teacher and parent rating scales that can be done. Um, the most common one is the Vanderbilt's, but a lot of schools do Connor scale, and there can just be an informal classroom observation as part of the evaluation. So this includes um, a teacher or a therapist or counselor from the special education office or the IEP team sitting through a classroom and just noting down what the child does throughout the classroom. And sometimes that can be really helpful for um, the IEP team or the pediatrician or even the child psychiatrist, if a child psychiatrist is involved, to see that testing. An achievement of testing is their reading, writing, and mathematic ability level. So after you do the testing, and if there's some impairment that requires interventions that can be done in the classroom, but of which outside resources are not needed, this could include for things like ADHD. There's a lot of different types of accommodations that could be done. This also includes for anxiety, um, poor self-confidence, trouble communicating with peers, people that have had conflicts with other students. So for things like ADHD, you can have an accommodation of extra time on tests and assignments. This is the accommodation that's more common. You can have reduced homework. You can have chunking of assignments. You can have a situation where instead of an essay being due on Friday, you can have one paragraph due on Monday, another paragraph due on Tuesday, the third paragraph due on Wednesday, have the full rough draft done on Thursday to help provide structure for that child with ADHD to make the steps seem less daunting and more achievable. You could have adjustment of the class schedule, um, especially for, let's say, school avoidance and anxiety. You can have the reintroduction to class be a upward titration of classes. So they start off the first day with one class, the second day with two classes, then you do two classes for 2 days, and then you do three classes for 4 days, and then you slowly build up. You can have notes from the teacher. You can have calculators. People sometimes record. You can have textbooks that break things down into smaller steps. And this is even true for visual and hearing impairments. So sometimes people can have tests read out loud. They can have more one-to-one support during testing to help redirect them. And you can have individualized homework assignments as well. Some other things may seem simple, but can go a long way. One is preferential seating, seating away from peers, switching the classroom if there's a bully in that classroom. And a lot of times you could have the student take frequent breaks or rest periods. So this is sometimes when people with sensory sensitivity, if they feeling like they or like the warning signs are coming up, that they're um, feeling frustrated, they could take a break as needed. A lot of times teachers can check in with the students. They can highlight specific things, or if there's a point that they know is difficult for them, they can provide extra encouragement or make sure they understand a few key steps that, for example, if a student has trouble with multi-step math problems, that's an area when the teacher starts going to that topic, they can really intervene with that small particular step. Another thing that's really helpful for parents is daily and weekly report cards. Having that constant communication can be a big help for families. And you could also have encouragement to use a planner. This is especially true for high schoolers, um, where there'll be the assignment that the teacher gives, it'll be written down, or the teacher can have the student write it down, but the student needs to check with the teacher that he or she has written down what's needed, and the teacher can sign off on it. So this is one ways you can make it more specific. I already mentioned a few of these, but for anxiety, um, just to get them into the school, the best way to do it is gradual exposure. So you don't want the child staying home, but you also don't want to flood the kid by having them go through a full school day where the hallway's busy, the cafeteria seems overwhelming. So you can actually have the ability to take space in the counselor or nurse's or therapist's office, or you can leave class a minute before or a minute after to avoid switching classes at the busy time. So sometimes they go like a minute before the school bell, 2 minutes after the school bell, to making sure that they're not in the hallway where, some of the high schools in Delaware can get really crowded in the hallway, and that's the area where kids are most likely to have panic attacks. There's just an underlying anxiety disorder. Um, and I already mentioned some of the tasks for learning disability. So here's a little bit of the side by side comparison between IEPs and the 504. I already talked about that free appropriate public education. Some other points is federal and state funding is associated with IEPs. Um, the IDEA Act only covers till age 22, whereas 504, because it's part of a civil rights bill, is lifelong. Um, and also the governing body differs. So when you get into the legal matters, it the enforcement mechanisms are different and the details differ. But the biggest difference is 504's accommodations within the classroom. IEPs and IDEA Act is stuff that's outside of the classroom where they're bringing in supports. Um, One of the other key parts is after the parent, and this is key, after the parent signs consent, not when they ask for an IEP, but when they actually sign consent for the evaluation. It's 45 school days or 90 calendar days, whatever's quickest to get that evaluation. And in evaluation, if a child qualifies for an IEP, they need to have an evaluation completed with all the components every 3 years. So here's some of the more other components of it. I already mentioned now on the slide before 504 is to the left, on this slide 504 is to the right, but they both need to be reviewed annually. Um, Students can achieve accommodations afterwards, but for a lot of people under IEP, even if they're diploma track, certificate track, they're entitled to resources up until age 21, sometimes 22. Um, and that's if they qualify for a transitional program. So a lot of times when people graduate high school, they could still fall under a transition program that helps them prepare for adult life. This often includes life skills, vocational rehab, learning how to do tasks such as ride the bus and cook. Um, Least restrictive environment is also important, where sometimes schools want to remove a student from the regular feeder school and move them to another school. But if the child is able to function in their feeder school, then they have the legal right to be in there. So as I mentioned, obtaining an evaluation for families, child find is often helpful in the preschool population, and an evaluation can be done at any time. The key part from a legal matter is signing the consent form or signing the permission form to get tested. So th this is a little bit of a technical matter that matters when you're advocating for your child to get resources. Just because a child has a psychiatric diagnosis, that's helpful to inform the IEP team at the school. But there's this wall that exists between the psychiatric slash medical world and the education world. So a child may qualify for or may meet the diagnostic criteria for depression or anxiety or ADHD, but the school may say, hey, we don't see enough impairment in school. We don't necessarily need to make any accommodations based on a medical diagnosis. On the other hand, people may qualify for 504 or IEP resources and may not necessarily meet a medical or psychiatric diagnosis. So a lot of times there's a good deal of overlap, but legally speaking, a school isn't required to take documentation from a doctor, but also just because a child's diagnosed with something in the school doesn't mean that the child has to meet the criteria for a medical or psychiatric condition. So this sometimes happens in the world of autism. So a lot of times people meet the educational different definition of autism, um, but may not get that diagnosis from an or outside psychological evaluation, which sometimes can be confusing to the parents because the diagnosis should hold steady. But a lot of times, schools will use that classification to get the resources that normally would be helpful for the student. Some of the ones that are often used, such are headphones and other sensory tools. This can help them focus. It could help them feel less overwhelmed. They could have social skills group, like I mentioned, lunch bunch before, and some schools can have ABA resources. Now, a lot of times these resources or interventions can be helpful for students who do not have autism. So they could be helpful for someone with intellectual disability. They could be helpful for another diagnoses. But the autism classification can help enable some of these resources. Um, Behavior disturbances, this could be as a result of ADHD, PTSD, anxiety, oppositional defiant disorder. So behavior disturbances is more of a symptom, not necessarily a diagnosis. But regardless of the underlying diagnosis, especially in elementary schools, there's a lot of school-wide interventions that can be very helpful. Use of coping strategies, behavioral plans, reward system, dojo points is a commonly used platform where there's a specified list of stuff or activities or goals the child can do. It can be specific, it can be small, but if the child does it, hand in homework, wait in line, um, able to participate in group activities, then they get a JoJo point and they can cash in the JoJo points for either an activity or a small prize or extra recess time. Um, and some of the other accommodations can be, as I said before, switching classes. Giving the child activities to do can be helpful because if the child is engaged, especially with ADHD, in a helper role, such as wiping the whiteboard or putting the pencils away, that can be a big help because they're doing something. And if they're doing something, they're not being distracted by negative peer influences. And I mean, there's also what I call pro-social groups and clubs. A lot of times, especially in older peers who may have more negative peer influences, if there's encouragement for them to participate in other clubs, that gives them a sense of identity, gives them a sense of something to do. So they're not as much caught up with other influences. Um, In-school therapists can be helpful. Trying to limit the use of suspensions is important because a lot of times suspensions can be reinforcing of negative behavior or maladaptive behavior because when they get suspended, they can get out of work. Um, and if they realize if they act out, they can get out of the class assignments. And there's a role for outside providers as well. Most importantly is psychologists and therapists that can coordinate with the teacher. So there's often, for academic struggles, parents often initiate the testing process, um, but sometimes it could be visual processing, auditory processing conditions that need to be ruled out. So you can change how the schoolwork is presented. You can provide additional classroom supports. If it's more of an intellectual disability or severe specific learning disorder, they might need a smaller classroom setting so the academic work can be at their level. A lot of times, people could be at the wrong academic level with respect to schoolwork. Um, I already mentioned a few of these for anxiety. But other things that could be helpful is use of a support system, a coach, a teacher, other peers or classmates, sometimes walking in with a teacher or their favorite coach can be helpful. Sometimes having a reward of, hey, you get to sit with the school resource officer and play Legos during lunch if you're able to process and work through the morning session can be helpful. And the teacher can also use coping skills or encourage the use of coping skills. It could be in elementary school, like a cool down corner. It can be encouraging use of taking deep breaths. It could be allowing students to have fidgets and other distracting toys at the desk. So here are some of the barriers for families. Um, we already touched on a little bit about this, but the most important thing is having parents understand their rights and say, hey, I'm giving permission for a IEP evaluation. Would you please check to see if there's anything that's impairing my kid's functioning or my kid's ability to learn? And even if there's no personnel available at the school, like there's no occupational therapist or speech therapist at the school then needs to hire someone who's private and on the outside. Um, and some other places that can help is referring people to a family advocate. These are people that work with the family and guide them through the IEP process. You can also, even though it's not needed to get an IEP evaluation, writing out having a template letter saying, hey, I evaluated so and so. He has been diagnosed with ADHD. I would request an IEP evaluation. Just those three sentences can go a long way for help within the IEP system because sometimes some schools do triage children based on whether they have a letter from a pediatrician or another specialist. It shouldn't be that way, but that's how a lot of schools have operated because there are a lot of more and more kids that are requesting IEPs and 504s, and just a lot of psychoeducation for families. Um, so these are some of the other outside supports, self-inclusion classrooms or smaller classroom settings, occupational therapy, especially help with handwriting and hand-eye coordination, um, additional reading time, additional mathematics time, or even a one-to-one aid. A one-to-one aid or staff support is usually as part of an IEP. So I just want to leave with the idea that parents can be empowered. This is not just taking whatever the school does, but a lot of times when parents talk with the school appreciates the parents' effort because they really want to encourage parental involvement as well. And, a lot of times just even getting the testing can be a big help because otherwise getting a psychological or an educational evaluation for intelligence or achievement testing is really hard to get in the outpatient setting.